Palooza. We appreciate all of you for coming out, doing some exposures, challenging yourselves, being brave and courageous. I should introduce myself. So hi everyone, I'm Stephanie Leto. I'm a psychologist in the OCD program, and I will be introducing our speakers today. But first we wanted to start off with some very important thank yous. So thank you to our sponsors who are listed behind all of you. Thank you to all of our volunteers. I appreciate you so much. We would not be able to make this event happen without you. And a very special thank you to our OCD program ambassador, Dr. Moksha Patel, who is here somewhere, who is always happy to answer questions, talk about OCD, all of those fun things. So, we wanted to start off with one of our speakers who is an IOCDF Advocate. So Kyle King is a first-year medical student at Yale School of Medicine. Kyle has been recovering OCD since middle school and has been heavily involved in OCD advocacy through the International OCD Foundation. So please, come on up. Yay, happy.
Hey everybody. I should probably figure out how this works. There we go. Hey there. My name's Kyle. The rumors are true. I'm a medical student. I'm an IOCDF Advocate, and most importantly though, I'm someone with OCD, and I wanted to spend today kind of sharing a little bit about my journey with the disorder and my journey towards recovery. Normally when I start talking about my disorder, I start by explaining the story where there was a library book and I touched it and I felt contaminated after I touched it, and then I went to wash my hands. But when I was thinking about what I wanted to talk about today, I started to think, there were probably things that happened before that library book, in 6th grade is when that happened, that may have indicated something was going on. But, on the whole, kids have quirks sometimes, and no one thought twice about it. And when I was thinking about those moments, which I dubbed early clues, two things kind of came to mind. One memory was in 3rd grade, when a resource officer came to one of my classrooms, and he was talking to us about being secure on the internet and watching out for predators. And I remember for about 3 weeks after he came to our class, I made my parents go outside my room every night and check the windows to make sure no one was watching me while I was sleeping. And they thought that was weird, but they didn't say anything about it. They just thought it was one of those quirks and not a clue of anything else. And then a couple years later, I was on a family vacation in Vancouver, and I got this thought while walking around that someone may have put a tracking device on my back, and they may be following me to my hotel to abduct me later in the night. So when I got back to my hotel, I took off my shirt and I started washing it in the sink in the bathroom. And my parents came in and found me. They were like, "What the hell are you doing?" And I explained to them what I was doing, and they looked at me like I was crazy, and they explained to me that this was not something I had to worry about. And they kind of swept it under the rug as just a little quirk and not anything more than that. And then in 6th grade is when I had this thing with the library book, like I said. And basically what happened there is I went to the library with my mom one day, and we took out a book, I brought it home, I read it for a little bit, and I put it down on a table. And when I put it down on a table, my hands felt weird. They just felt like tingly. And they felt dirty, and I couldn't really tell you why they were dirty or what was dirty about them. I just didn't like the feeling. And I remember having the thought that I should go wash my hands because that will get rid of the feeling. And because I'd never had the feeling before, I went and washed my hands, and it got rid of that tingly feeling. And it reinforced this idea that, okay, when I get this feeling, I'll go wash my hands, no big deal, whatever. And then the next day, when I picked up the library book, the same thing happened. I picked it up, read it for a little, put it down, got this feeling again, and then I had that thought, okay, I should go wash my hands. And tomorrow maybe I shouldn't pick up this library book, because maybe it's just contaminated. And then I got the thought, okay, well, maybe I shouldn't touch the table that the library book touched, because that table is not contaminated. And maybe I shouldn't touch the mug that was on the table that touched the library book, because that mug was on the table that touched the library book, so it's probably contaminated now too. And this was my introduction to the logic of OCD, or at least my OCD, where there was a lot of magical thinking and magical thoughts, and some things were contaminated and some things weren't. And my parents noticed me more systematically avoiding things in my life around this time. And they took me to my first therapist. And in honor of her being my first therapist, and trust me, there's been many after her, I'll call her Dr. First. Dr. First asked me what was going on. I explained what I just explained to you all. And she said that I had anxiety, not OCD, just anxiety, and that I should go home, I should touch the library book, and I should resist the urge to wash my hand. And I said, that's a great idea, and then I did the exact opposite of that. I either went home and touched the library book and then immediately washed my hands, or I just didn't touch the library books at all. And for the summer in between 6th grade and 7th grade, when this was all happening, it didn't get too much in the way of my life. There were some things that were contaminated, there's some things that weren't, but it didn't stop my functioning at all. And then came 7th grade, and that's when my OCD really evolved, if you will. I'm gonna stop the narrative form of my story for a second to throw in a disclaimer right here. My core fear when I had OCD was I was scared I was gonna catch autism. I was scared that in some way I would be contaminated with autism and then I would develop it. I knew then, and I know now, that that is completely irrational. And I'm being really transparent about what my core fear is. One, because I don't want to stigmatize autism at all, and I want to be transparent about that. And two, I feel like it's really important that we share how irrational our core fears can be and how strange they can be, even when we know that they're strange, because if we don't share exactly what's on our mind, it's gonna be a lot harder to get proper help. I always feel uncomfortable when I share that core fear, but I wanna be transparent with you all. So, like I said, in 7th grade, I volunteered to help out with the classroom with autistic children in my middle school, and the first day I went, I helped out, I sat there, and I started to get a little bit uncomfortable again. I started to feel contaminated, and this time across my whole body, and I didn't really know why again. I just felt wrong, I felt off, and I felt like I wanted to go home and shower. But you know, I stayed in school, I felt off, and then when I went home, I thought, you know what, I probably shouldn't touch the things that I want to touch tomorrow, because I want to make sure those stay clean. And I also got some Lysol, and I wiped down my backpack, and I wiped down my folders. And when I went to do my homework on my home computer, I put a piece of paper towel in between the keyboard and my fingers so my keyboard would be clean for tomorrow. And then at dinner that night, I didn't sit in my normal chair. I sat in my sister's chair. She wasn't home at the time, and my parents asked me why, and I said, I just want to mix it up. But it's because I wanted to make sure that chair was okay for tomorrow. And I made all these little concessions to my OCD, because I didn't know what OCD was, and my parents didn't know what OCD was, and I thought that it wasn't that big of a deal. But that was the beginning of OCD taking over my life. And between then, which was in August, and about January of that same, I guess the next year, my life completely fell apart because of this disorder. And my life became all about trying to follow these rules in my head that I knew at the time made no sense, but I couldn't help but follow. Rules about what was contaminated and what I could touch, and what wasn't contaminated and what I shouldn't touch if I were contaminated, because I wanted to keep it clean. And this constant battle in my own head about whether or not I was contaminated, and the rules about what made me contaminated kept changing every day. And I could go through all these rules with you guys, but it's terribly confusing, and I don't really think it's worth justifying them by recounting them. But I do want to give you a sense of how OCD impacted me. So I want to take you through a few kind of flashbulb examples from this time in my head of bad memories I have, I suppose. So here's a little makeshift timeline I made in PowerPoint. It's not very good. The first memory I have is of Halloween. Me and my family, we always used to do this big, haunted house in front of my house, and I always loved setting it up with my parents, sometime actually around now in October. And on this particular Halloween, when my OCD was kind of near its peak, my right hand was contaminated. I don't know why. OCD had convinced me my right hand was contaminated. My left hand, it wasn't contaminated. So I was trying to help out setting up this haunted house, but I couldn't use my right hand. So I was doing everything with just my left hand. My parents knew better than to help me at the time. They didn't want to accommodate my OCD. So they were letting me struggle with just my left hand. And I very vividly remember setting up this scarecrow in the front of my house. And it required 2 hands to set up. So I kept trying to put it up, kept falling over, put it up, fall it over, put it up, fall it over, or it fell over rather. And I just remember bursting out into tears in front of my house as a 7th grader. Because this was the first time I could remember where OCD had stolen a tradition from me. It had stolen something that I looked forward to all year, that I loved to do with my family, and now I couldn't do it because of these rules in my head. And I just remember feeling so powerless. Flash forward a little bit to November, I'm walking to the bus stop with my friend Jeremy, and I'm wearing a button-down that's about 2 sizes too small, and jeans that are about 3 sizes too small. And I'm wearing those clothes because it's at this point that OCD's convinced me that none of my clothes are clean anymore. So I couldn't wear them to school. The only thing I could get myself to put on were these kind of old clothes I'd found somewhere deep in my closet and that I knew looked weird, and I thought kids maybe would make fun of me. And they did. And they called me a cowboy, and they called me a bunch of other names that I probably won't repeat. And I went home after wearing those clothes that day, and I went to my room and I cried again. Because I couldn't explain to them what was going on in my head and why I was wearing those clothes, and even if I did, I don't think they'd really get it. And I just felt alone. Flash forward a little bit to hibachi. It's early December. My sister's home from college, and I asked my parents, can we go to hibachi? And they say yes immediately, because this is the first time in months that I've showed any interest in doing anything other than just listening to my OCD. So we go to hibachi, and I'm super excited, and my parents are super excited, and we're seated at a table with another family, and for whatever reason, someone on the other side of the table triggers me. And I get super anxious all of a sudden, and I dash out of the restaurant. And my father comes with me, and he sits down next to me, and he asks me, Kyle, you have to come back in. We came here for you. We just want to have a good time. And I tell him that I can't, because OCD won't let me. So he goes back in, and my family has dinner, and I sit on the curb by myself for about 2 hours, just waiting for them to finish, so that my life can continue. Fast forward a little bit to Christmas Eve that same year. My whole family's down. They want to go to the beach. They ask me if I want to come, and I do, but I say no. Because my OCD tells me that if I go, there's a chance I might get contaminated. And if I get contaminated, well, then I can't open my Christmas presents the next day, and I can't play with any of them. So it's not worth taking the risk of going. And so my whole family goes with me, and they have a good time, and I wait at home, trying not to touch anything. Because if I do, then I won't have a good Christmas. And that's all pretty bad stuff. That wasn't my rock bottom quite yet. My rock bottom came in January, when I'd gone to a party, and I got contaminated at the party. And the next day, I felt so contaminated, and OCD told me that I was so dirty that I couldn't touch anything in my house, and I had to find a place that I could go, and I could sit there and just decontaminate all day. And the only place that had been left in my house that I hadn't already done something like that in was underneath the piano in my family room. And the only piece of clothing I had left that wasn't contaminated was a single piece of underwear. So for that whole day, I sat under the piano in my family room in my underwear. I didn't eat, I didn't drink, I didn't read anything, I didn't talk to anyone. I just sat there and watched my family mill about my house, wasting away. Because I was so stuck in these rules in my head. And that was really my rock bottom. Because at that time, I wasn't able to use my phone, I wasn't talking to any of my friends, I couldn't play with my dog, I couldn't watch TV, I wasn't sleeping in my bed. OCD had taken absolutely everything from my life. And you notice too at the top of this timeline, this is kind of like my makeshift therapy timeline, if you will. I'm seeing a different therapist than Dr. First. I'm seeing someone named Dr. Moritz, and she's an OCD specialist, unlike Dr. First. And I started seeing her back in October when I talked about Halloween. And it was actually back in October that she diagnosed me with OCD. She told me I had OCD, and she told me that there's a cure for OCD. It's called exposure response prevention. And in a nutshell, the therapy is go do the hard thing, go do what scares you, don't do anything about it. Just sit with that anxiety. Learn through action that OCD is lying to you. And when she told me about ERP, I said, that's great. I'm just not gonna do it. Because I was way too scared of OCD's rules, and I was way too caught up in all the lies it was telling me to risk pushing against it. So you'll see, I kept getting worse in this kind of bottom timeline, while my therapy continued and actually increased. By December, I was going to therapy for about 5 hours a day. I was just lying through my teeth to my therapist. And I was lying through my teeth to my parents. And I was lying through my teeth to my sisters that I was doing all my exposures. I was lying to everyone and saying that I was really fighting against my OCD when I was on its side the whole time, because I was way too scared to confront it. And then when I was sitting under that piano in January, something in my mind changed a little bit. Because it was when I was sitting under there for 12 hours doing nothing that I realized that all this lying, all this deception, it was only hurting me. And that all this exposure therapy that people have been telling me about, it was more than just kind of touching something here or using my phone this day or that day. This was a fight for my life. In reality, I was either gonna fight my OCD or I was just gonna die. And I started to reframe this fight against OCD as less than just kind of this trivial wanting to get things back or wanting to sleep into my bed one night versus the other. And I started to frame it as a fight for my existence. And for some reason, that really motivated me. So after this one day in January where I was sitting under this piano, and I'm simplifying a little bit for the sake of time, I started to care, I suppose. I started to want to fight my OCD because what did I have to lose at this point? And I started to do exposures in earnest. I really did. And I did some well and I did some poorly, and I had some good days and I had a lot of bad days. But slowly and surely, I started to get a little bit better. I asked my family for some pictures from this time to illustrate some points to you guys. They only kept pictures of good things, so I only have pictures for this part of the presentation. So here's, it's not gonna move, all right. There. Here's a picture of me sleeping in my bed for the first time in months because OCD had taken that from me. Here's a picture of me using my phone for the first time in 7th grade. I did have a bowl haircut because OCD had taken that from me. And that final picture is me and my dad in Boston because that was the first time I had left Florida in months because OCD had made it really difficult for me to do that. And what these pictures illustrate is over the course of a few months after I started to really do exposure therapy, I got my life back from OCD. It was hard. It was the hardest thing I've ever done, but it worked. And what I hope that story communicates is that if I could do it, if that little kid sitting underneath a piano for 12 hours in his underwear trying to forget that he existed could do it, then I'm really confident that anyone with OCD can get out of the hole that this disorder digs for you. And now, I spend a lot of my time advocating, and I spend a lot of my time talking to different people with OCD and trying to help them on their journey. And I've been doing advocacy work for about 10 years. I started this group with the International OCD Foundation, where there's like 400 or so young adults with OCD, and we all kind of support each other. And I talk to a lot of people with OCD. And in these conversations, a number of things come up pretty frequently, and I wanted to share kind of 3 things that I find myself saying a lot with you guys. First, OCD will always lead you away from your values. It's always going to lead you away from your goals. My OCD convinced me that if I were to follow its rules, I'd be a better person, I'd be a smarter person, I'd be all these great things. And it was just a lie the whole time. It always was lying to me. And I feel like it's really important to remind myself all the time that every time OCD feeds me an idea, that it's just a lie. because it can be really seductive and really deceptive, and I really need to keep that idea top of mind. 2, in fighting OCD, it's really important to have a short memory, because there's been a lot of exposures that I haven't been able to handle well. And there's been a lot of times that I've tried to fight OCD and I failed. There's been a lot of good days and there's been a lot of bad days. But it's important to take each day as a new one and each exposure as a new one and forget what happened yesterday and approach each exposure like it's your last. And 3, fighting OCD is the hardest thing I've ever done. I think it's probably going to be the hardest thing I will ever do. But fighting OCD in earnest was the best decision I ever made in my life. And doing that short-term work, having that short-term pain, the payoff is impossible to describe to be free from OCD. Thank you for listening.
As a reminder, we want you all to be able to hear the lived experiences of individuals with OCD. So, our next speaker is one of our very own OCD Program IOP clinical coordinators. So Alli Garza is a professional yapper, so I will be giving you little time cues. She will do a wonderful job and is an IOCD advocate, and her official bio is that Alli is the clinical coordinator of the OCD and Anxiety IOP at CU Psychiatry. She pulls from her own experience with severe OCD and is an advocate with the International OCD Foundation. So, Alli, please come on up.
So as Stephanie said, my name is Alie Bernard Garza, and I am the clinical coordinator of the OCD and Anxiety IOP here at CU. Alongside that, I'm also an advocate with the International OCD Foundation. As someone who went with misdiagnosed and untreated OCD and ADHD for over 15 years, my career path and my own lived experiences are deeply intertwined. But the work I do here is meaningful, not only because of what I get to do, which means so much to me, but also specifically that I'm doing it here, seeing as I grew up not too far down the road from here in Superior, Colorado. When looking back at my childhood, it is not much of a stretch to see my ADHD symptoms. My first word was hi, and I used it liberally. My 4-year-old neurodivergent brain could not understand why I wouldn't call my parents by their first names like everyone else did. So between the footage of me yelling Lori from my crib, tumbling around like a wrecking ball with little to no spatial awareness, and living to perform in front of the video camera like I was a reality TV star, I would say that is more than enough data to say that when they called me a spirited child, they really meant an undiagnosed ADHD child. Now, on the other hand, if you were to ask my parents if I was a nervous or a fearful child, they'd probably say no. And aside from instances like Splash Mountain here, I would say that I rarely presented in a way that would appear anxious to those around me. And I think that because my anxiety and OCD were mostly an internal experience that rarely left my head, it put me in a position to be even more vulnerable to be missed by providers when being diagnosed. In middle school is when my anxiety really started to amplify. Having undiagnosed ADHD and OCD made school feel like solitary confinement for me. And avoiding school felt like a means of survival during a time in my life in which I couldn't identify, let alone verbalize, what the symptoms I was experiencing were, let alone try to explain it to someone else. So I would stay home, I would teach myself the stuff I needed to know for school, do the assignments, finish the projects, take the tests, at the rate of the Energizer Bunny, so that then I could spend the rest of the day engaging in things that actually interested me, which, at least were consistent, being mental health, higher education programs, and advocacy. However, the systems that I was in made it very clear that I did not belong. While my parents saw my neurodivergency as an asset, the system felt otherwise. And no matter how hard I tried to shove myself into the box of neurotypical standards and expectations, it just continued to lead to burnout, depression, and feelings of isolation. Fast forward to 2016. At this point, I graduated from college and was working in youth development. It was during the summer that things took a very sharp downward turn. Despite experiencing OCD symptoms on and off throughout my entire adolescence, this time was very different. OCD had hit me like a ton of bricks, and it felt like within an instant, intrusive thoughts, images, urges, and sensations were bombarding my brain, telling me that I was a dangerous person and I was out of control. First, it started with me not driving on the highway, then I stopped driving on roads without medians, then I stopped driving on main roads, then I stopped driving on side roads, and then it got to the point that I stopped driving altogether. Then it got to the point that I was too scared to even be a passenger inside of a car. Similarly, I was scared of being in confined places with others. What started as avoiding movies became concerts, became libraries, became presentations, became malls, and then became airplanes. And it continued to snowball and snowball and snowball, as OCD seems to do best. I tried to see if a change of scenery would help in the midst of this time in my life and went to San Francisco. And in this picture, I was battling one of the absolute darkest times in my life. I think, as I said earlier, one of the challenges was that internally I was suffering so greatly, but to the outside world, you wouldn't know unless I told you. I still remember the drive over the Golden Gate Bridge here to take this photo so clearly. OCD was pounding in my head, telling me I had to sit on top of my hands, repeat certain lines in my head over and over and over again, and close my eyes over and over again, all while sweating profusely, just trying to get to this end point. At this point in my life, I thought I was the only person on earth who struggled with this. I had never heard of ERP therapy or even of OCD that existed outside of themes related to contamination or symmetry. The stigma kept me very isolated, and I resorted to white knuckling, trying to block out OCD, as that seemed to be the only way through at the time. Fast forward to 2020. At this point, life has moved forward. I moved to Seattle. I finished my master's at the University of Washington. I moved to Portland with my husband, Adrian, and was working for a youth crisis line at the time. I was struck by this illness during the pandemic that kept my eyes swollen nearly shut and was fatigued for nearly a month. I went to doctor after doctor after doctor, and no one could figure it out, and they never actually did. Amid the uncertainty of my health issues, OCD began to take root and sneakily grow and spread wider. In a matter of weeks, the amount of places I allowed myself to go was getting smaller and smaller and smaller until I rarely left the house. To avoid the intrusive thoughts and anxiety, I would sleep until the point that OCD wouldn't let me sleep, and then I would pace throughout the night. Then I was no longer enjoying activities like watching TV, listening to music, or reading. And I even started to restrict my diet to avoid foods that could potentially trigger any type of medical condition or reaction. Peanuts, tree nuts, caffeine, decaf, spices, anything I've never eaten before was off the table. I found myself repeatedly visiting the ER, convinced each time that this time was different. I started to wonder if it would be safer to sleep in my car in the ER parking lot, because OCD and anxiety was always telling me that when an emergency struck, every second counted. 6 months in of feeling like I had tried absolutely everything, I knew something new needed to happen. Through scouring the internet, I happened to stumble upon a therapist who specialized in OCD. Despite me being a clinician myself at this time, I had still never heard of ERP. I had no idea that OCD could be outside of those two types of themes. And through this therapist that I got connected with, I discovered for the first time in my life that I was far from alone. That the losing battle that I had been fighting over and over and over again was perhaps winnable. That actually what I was living through was something that was highly treatable, and that maybe there wasn't something incredibly wrong with me. Maybe the problem wasn't that I wasn't trying hard enough. Maybe the problem was actually that the tools that I had been given for the past 15 years were not only ineffective, but actually getting me more stuck and sicker. This realization evokes simultaneous relief and fear. At this point, I had seen so many providers and done so much treatment, and I was supposed to allow myself to hope that this time would somehow be different. But OCD caused my life to come to a screeching halt, and I was willing to do anything for the chance of the life that I longed for and worked so hard for. That just always seems to be out of reach for me. People often wonder and ask me when they should pursue a higher level of care, such as intensive outpatient, partial hospitalization, residential treatment. During this time in my life, there wasn't much of a question in my mind when I considered residential. I wasn't living my life. I was living the life that OCD wanted for me, and there was little to no room in that life for the things I cared about, let alone me. So I took a massive leap of faith and went down to McLean's OCD residential program down in Texas. And when I say leap of faith, it sounds poetic, but really it felt more like free falling. Genuinely unsure where, if, or when I would land and what that would feel like or look like. The beginning of my exposure and response prevention treatment can be best described by these photos, which there are many of. I was realizing that I had so many of these selfies because every time my husband texted me to ask how treatment was going, this is how I responded, which was accurate. So, at the beginning of treatment, I was far from sold on ERP. My brain was swarming with questions. How do I know this will work? What if it works for other people but not for me? What if I'm wrong and I'm actually in danger? What if I don't even have OCD? How can I know that I'm gonna get better, and if so, how long will it take? But ultimately I knew that what life looks like otherwise was not a life I was willing to have, and I refused to allow that to be my story. Every day I had to face my greatest fears dead in the eye and choose to do the things that my brain was telling me were dangerous and maybe unsurvivable. And I chose to do this because I knew I deserved a full life, not one filled with rules and restrictions and living in a state bracing for impact for what would hit next and walking on a tightrope, terrified to make one misstep. ERP treatment became a way of life, and I learned that leaning into anxiety was actually leaning into trust and confidence in myself in the midst of fear. And what that looked like ranged greatly from, as you can see on my desk here, from treatment, eating peanut butter to Nutella, to taking a supplement, to taking a Tylenol, to eventually driving on the Houston highway, to taking field trips with my therapist to the cemetery. For my friends, it sometimes looks like the middle one of pictures of their cat in the fridge, which the first time definitely took me off guard, the little fridge there. Or bananagrams on the floor, or field trips to public restrooms, or decorating cookies with profanity and icing, and the list goes on. In a matter of 2 months, all in, every day, all day ERP, while surrounded by others who got it and were fighting their own version of the same battle, I was a completely different person. I was the fullest, truest version of myself that I didn't even know was possible. ERP gave me the life that I continuously fought for, but OCD held out of reach. Prior to ERP, I could not figure out why white-knuckling my way out was not working, despite how hard I was trying. While I kept sitting on new couches in new therapist offices, only to feel like I was talking in circles and stuck, no matter how hard I tried. The tools that I learned from ERP changed the lens through which I see the world, and the people that I've met through treatment and advocacy are some of the most empathetic, creative, passionate souls out there that I'm proud to call friends. And along with that, they're a constant reminder that I am far from alone. There are people who get it without having to explain a thing, community that I longed for but didn't think existed, going through all those years of fighting alone. And that the groups that are in those photos there are my friends from residential treatment. My world is bigger and brighter and more exciting when I lean into uncertainty and pursue a life based on values rather than fears. And this joy is only compounded by the opportunity that I get to support others in doing the same. My career after residential treatment has taken me from working in mobile crisis in Portland to starting a youth OCD and anxiety IOP to actually going back to where I received residential treatment, except this time as a clinician, to now where I'm at back in my hometown or home state, being part of the OCD program here in our IOP as well. OCD is still absolutely along for the ride no matter where life takes me, but I'm the one in the driver's seat choosing the path forward now. Opportunities like this always bring me back to those times in which I refused to even allow myself to acknowledge the intrusive thoughts I was having, let alone speak them aloud. So I so appreciate you allowing me to share a piece of my story and support the mission of our program of reducing stigma, amplifying advocacy, and making it possible for us to provide the accessible, quality, evidence-based treatment that changed and saved my life, and that everyone struggling with OCD and anxiety is able to receive as they deserve. Thank you.